To use the Lico Ultra Freespan twin motor hoist, which is usually set up in the form of a gantry, you need to be sure that you have several things. One is that you have the correct sling ready under the patient. You also need to do some pre-use checks on your equipment first. This is not a mobile hoist, so therefore the brakes need to be on. Brakes are down here, and there are 4 wheels on each side which all need to be checked. You also need to check that the handset is on charge and released, and that all the carry bars are going to work. There are two sets of buttons up and down. One operates both together. The other operates the single wider of the 2 carry bars independently. This is useful for positioning patients, many of whom are going to be our bariatric or plus-size patients and may not be able to sit in the same positions that other patients can. Once you've checked it, put it back on the charger until you're ready to go and position your patient in the sling. It's also useful to have a slide sheet, one of our long single slide sheets, folded in half under the patient's heels to protect them when you're moving the patient from the bed into the chair from friction and shearing on their skin. Positioning the sling underneath the patient has been covered in another video, and the method for that is exactly the same. However, it should be noted that because this is a single span carry bar, you must check that these small metal clips are in place before you attach the sling to it. It's important to also check that both of the red clips are securely attached to the clips on the lift straps. Many loop slings, which are those which are compatible with this type of carry bar, will give you a selection of loops. Check the type of sling that you have. On this sling, we have only one choice of loop at shoulder and one choice of loop at the leg section. The normal rule is that short loops on the shoulder, so the loop closest to the patient, and the loop furthest from the patient on the leg section will give them a good erect sitting position. Because many of our larger patients cannot sit fully erect, you may need to choose a different loop on the appropriate sling size for that patient. Many of our larger patients also cannot lie flat for any length of time, so it's important to make sure that you keep the bed semi-profiled. When you are using loop slings, it is also important to note that the leg sections, once placed underneath the patient's leg, are crossed. This is for both the patient's safety and dignity. Patients are more likely to fall out through the commode aperture if you have not crossed the leg sections. Also worth remembering that the leg sections, as you lift the patient, will move up between the patient's legs. The patient's comfort and dignity, particularly for our male patients, you need to ask them perhaps to hang on to the sling here if they're able to, but please watch that it doesn't move up too quickly. So we have positioned the patient in the sling. We are now going to move the carry bar across above the patient. Hoisting always requires a minimum of 2 people, and one person will always need to watch as the carry bars descend, so that they don't hit either us or the patient. Bring the carry bars down to a point which is comfortable both for you and for the patient. Reassure the patient at all times, and then attach the loops to the appropriate carry bar. As you can see, this will give us better positioning for the girth of our larger patients. We then need to raise the patient. Now sometimes, as with mobile hoists, this is a two-handed task because we may need to also lower the bed slightly at the same time. And here you can see how the leg sections move between up through the patient's legs. This is the point at which to check that the leg sections are nice and flat and don't cut into the patient's legs. As you can see, the slide sheet here prevents any shearing or friction on the heels and also allows us then to gently position the patient's heels off the bed as she moves across towards the chair. Let them go now, please. That's it. Always make sure you pick up the slide sheet from the floor and then, if necessary, reposition yourself. This will often be necessary with larger patients because we are restricted on space. So carry out your risk assessment before you start. As you can see, I'm using the independent carry bar to actually bring Valerie up into a better sitting position before we bring the chair in behind her. Gently lower your patient into the chair, making sure that you have brought the chair as close to the patient as you can. If need be, you can apply a little pressure on the leg sections of the sling to ensure that her bottom hits the back of the chair, also keeping an eye on the carry bar at the same time. Now we will bring this down as low as we can without making the patient feel uncomfortable, so that we can then detach the sling from the carry bars. Okay. If the patient's able to, there's no reason why the patient cannot press the buttons themselves. Always remember when you have finished moving the patient to return the twin motors to the end of the gantry and replace the handset for charging.